I wanted to update you on the knee replacement in room 12. He's managing stairs now, but is still hesitant about weight bearing during turns.
That's expected around day 5. How's his balance, Mihira?
Improving, but slightly unsteady when pivoting. He keeps confusing his progress with the hip patient in room 14. They're on a similar schedule but have different needs.
That can happen. I remember the hip patient also had an ankle sprain recently.
Exactly. She's avoiding the load on that side, so not ideal to compare them. The patient's confidence is the main barrier now, not a strength.
That's a key distinction. So are we still aiming for weekend discharge?
I'd recommend a short delay. If we push him too soon, he might regress. He's almost there, but pushing independence too early can backfire.
Fair enough. Mihira, let's give him another couple of days and reassess.
Agreed. I'll focus on more turning and balance tasks in tomorrow's session. MIHIRA, let me walk you through what the procedure itself involves, step by step. It's a very common and straightforward process. First, we will carefully clean the skin on your forearm with a special antiseptic solution to ensure the area is sterile. Next, I will inject a local anesthetic, a numbing medicine, around the lesion using a very fine needle. The main sensation you'll feel is a brief sting or pinch from this injection. Once the area is fully numb, you should not feel any sharp pain. The doctor will then take the sample. They typically use one of two gentle methods, a punch biopsy, which uses a small, circular tool to remove a tiny core of skin, or a shave biopsy, which gently removes the top layer. During this part, you might feel some pressure or a sensation of pushing, but it shouldn't be painful. MIHIRA, from start to finish, the active part of the procedure is usually over in just a few minutes. In terms of reassurance, it is considered a very safe procedure. However, with any minor procedure, there are small, manageable risks, such as a little bit of bleeding, the potential for a minor scar, or a slight risk of infection. Please know that we use sterile techniques and will give you clear aftercare instructions to minimize these risks as much as possible.